Laser rejuvenation is an extremely broad field. It could be anywhere from removing a red spot to a brown spot, to removing a wrinkle, to thickening the skin. So there's multiple layers, multiple lasers. It's a very, very confusing situation. There are multiple laser companies. There are multiple different kinds of lasers. They all have a different kind of crystal in the machine, which creates a different kind of wavelength, which does different things. Laser hair removal is one form of laser treatment. Pulse dye laser for red spots. Every different laser company has a different kind of laser that removes veins, removes brown spots, can produce an ablation of the skin to remove wrinkles. So lasers can do almost anything on the skin. So these procedures are done in our office. We want to be able to treat any kind of skin condition. It's one of our philosophies here that you can't just do surgery on a patient without when their skin is not in good condition. The aesthetics appeal of that patient will not be complete without having good skin, in addition to having a tighter skin following a surgical procedure. So we offer all the laser treatments that are necessary to improve any skin condition and to make that skin look as good as possible. So one of the problems with laser rejuvenation is patients don't want downtime. They don't want raw areas or reddened areas which take weeks to recover. So one often has to do repeated treatments which don't have the downtime. So instead of doing one big treatment, one might need 4 or 5 treatments over a period of 2 to 3 months in order to get the results they want. A lot of laser treatments today do not totally remove the problem. They do improve the situation. They can improve the redness in the skin. They can improve the pigmentation. But to actually remove all the redness, all the veins for a long time, or to remove all the pigmentation spots, or to remove the wrinkles, it's extremely unlikely to occur. One can get improvement in these conditions, but it's extremely difficult to get a young skin with young facial skin without any blemishes, etc. So most people over the age of 40 years old will have some skin condition that might respond to a laser treatment. Things which are not aesthetic, like lots of red veins, telangiectasia, big red spots, big brown spots, marked wrinkling of the skin. These are all patients who are candidates for laser treatment. In terms of the younger patient, they can undergo milder laser treatments to increase collagen to the face to try to slow down any aging changes that occur. There could be more younger patients coming in for these more benign, no downtime type procedures if they want to maintain the condition of their skin. This does not seem to happen so much. Most times people have actual skin conditions which are, marked skin blemishes, roughness of the skin, pigmentation, wrinkles, etc. Those are the patients who are showing up for their laser treatments. So with most laser treatments, there are certain parameters or settings that we put onto the machine to achieve results without causing any side effects. So that's the reason why there are a lot of estheticians or nurses who trained on lasers are able to effectively treat conditions without getting into trouble. If one double pulses or one does too much, one can get area of scarring or hyperpigmentation. So this one focuses on avoiding, and it's very rare now that laser treatments cause side effects. Downtime might occur if one is treating a lot, but that's not a serious side effect. The serious side effect is if you overheat the tissue and get a burn. And that's what we're focused on never happening in our office.